Welcome to the Leadership Winston-Salem October Leaders and Lunch webinar. For those of you who may be less familiar with Leadership Winston-Salem, we are a nonprofit organization that works with over 100 community leaders each year to educate, connect, and energize them to serve and improve the community through the flagship and insight programs. Hosting webinars like this is just one of the ways that we continue to educate our class members and stay connected with our alumni. At this time, I would like to introduce our moderators for today's webinar. Mr. David Wall, a member of the Leadership Flagship Class of 2024, the most class ever. David currently serves youth across Winston-Salem, Forsyth County schools as an engagement specialist with Imprints Cares. Born and raised in Winston-Salem, he finds hope in championing causes for gender equity, resilience education, suicide prevention, mental health advocacy, self-compassion, and social reform. David Wall returned home to Winston-Salem and education at the height of the COVID-19 pandemic. Seeing the need for greater support, he turned a focus on intentional local impact, serving families in Forsyth County, providing healing isn't just holistic, it can be homegrown. Thank you, David, for moderating today's event.
Thank you. And of course, thank you to all of our participants and attendees for taking the time out of your busy schedules to join us for Leaders and Lunch. So of course, I have four absolutely amazing panelists that I'd like to introduce. First, we have Amy Ball-Braswell. Amy Ball-Braswell currently serves as the Executive Director of Strategic Initiatives at Forsyth Tech. She leads or co-leads several adult or student initiatives, including REACH and NC Reconnect. Institutional improvement projects, including transportation, support, and manages the QEP Course to Career. As a native of Virginia, Amy has spent over 20 years leading grant projects and regional development initiatives across multiple sectors. She served as the 2022-23 ARC Appalachian Leadership Institute Fellow. Welcome, Amy Ball-Braswell. Next, we have Delan Mowbray. He's a veteran services. Delan Mowbray is a Navy veteran who had limited transportation options. As a result, lost his job and became displaced in January of 2023. He now works for the Veteran Services Program at the Goodwill Industries of Northwest North Carolina. He will share his current transportation dilemmas that exist for those who are doing their best to commute back and forth to work. Next, I have Jeff Fansler. Jeff Fansler is the Director of Transportation of the City of Winston-Salem, where he has dedicated his entire career to promoting transportation equity and mobility solutions. After earning an electronic engineering degree from Fairmont State University, he began as a traffic signal system technician and was later promoted to transportation engineer, overseeing major infrastructure projects. In 2018, he became the Deputy Director of Transportation, leading successful projects such as Old Salem Streetscape and Business 40 Betterments. Since April 2023, Jeff has served as the Director, managing public transportation, long-term planning, and operations for the City of Winston-Salem. He is also a member of Leadership Winston-Salem Flagship Class of 2025. Congratulations. And finally, last but not least, we have Mack Tolbert. Mack is the Director of AirCare Critical Care Transport at Atrium Health Wake Forest Baptist, where he has served for 16 years in roles including registered nurse, critical care transport nurse, assistant manager, and he became director in 2024. Mack has also been captain, paramedic at Piper's Gap Rescue Squad for over 30 years, and has worked as an emergency room nurse at Twin County Regional Healthcare and Northern Hospital from Surrey County. He holds a master's degree in nursing administration and a bachelor's in nursing from Chamberlain University and is highly regarded for his expertise in healthcare. Mack is a 2023 recipient of the Great 100 Nurses of North Carolina. Once again, to our esteemed colleagues and panelists, welcome. My first few questions are going to be for Mr. Mowbray. Mr. Mowbray, what were your specific challenges that you faced when your car broke down, and how did that impact your ability to find and maintain employment?
So first of all, good afternoon, David. And so for me, the challenges I faced when my car broke down, it the first thing and the major thing that led to the snowball effect of like just negative stuff was me losing my job.
Yeah,
So my job wasn't 5 minutes away. I worked like 30 minutes out. You have to travel the highway, so it's a longer commute than if it was inner city. So because my car broke down, I ended up losing my job. Uber, it can get pricey. If you're Ubering every day to work, it can get pricey, and then you still have every bill to pay and everything. So I ended up losing my job. Because I lost my job, bills started piling up. Phone bill, which was probably one of the least important one. Then rent came in, and you know how that goes. You owe 1 month and 2 month, and eviction notices and everything comes in, and that's where the trouble really, really kicked in. Because of the car that broke, I got evicted, and I was sleeping in my car. Actually, that's where everything really got terrible. I was sleeping in my car. It wasn't mobile. I was stationary. Parking lot. Wasn't able to work. I was still looking for more jobs and stuff, but it was hard getting a job that was close by where I could Uber. And then at the
exactly.
time, I didn't have public transportation, so I didn't take like the bus or anything like that. Because for one, when you have hope, I would say it can blind you to certain things, right? Because it can lead you to believe that you're gonna get help tomorrow, and
Right.
that tomorrow leads to 1 week, 1 month, 2 months, and then by the time you know it, it's been 6 months, and everything is already terrible. And so me not having my car, that really played a big role in probably the worst year of my life. I was practically homeless for a whole year until I got help. And if it wasn't for the foundation,
Right.
I don't know where I would be right now. Because it was December when I just felt like, okay, I can't do this anymore. It's been a whole year. I don't know where to turn, what else to do, and it was terrible. So losing my car, I lost my job. After that, snowball effect. I lost my appointment. Bills started piling up, and everything just got crazy. It was
That's
the
right.
worst year of my life.
That's right. And Dylan, I want to first thank you for one, walking back through that. Of course, going back and talking about how the snowball effect affected you personally between the lack of transportation and the hope that you felt was fizzling out. As leaders, as individuals here helping to help transform Winston-Salem in our city, what role do you think local governments or community organizations could play in addressing the transportation needs for those who rely on public transportation? Because you mentioned Uber being expensive, the cost of bills. What can local governments do to assist those that count on us for transportation?
I would say for one is to get the information out more to people, because if you're not somebody that usually dig for a certain information, you probably get left behind on a lot of things, because there's a lot of programs out there. There's stuff that the local community can help with, the government can help with in the city, but a lot of people just don't know about it. And that's where I realized not just myself, but other people that I met the same year didn't have certain information. They didn't know about certain things, because you
Right.
have to call, and when you call one place, you know, you get transported to another one, and you have to kind of tumble around before you hit the right person or the right line or the right program. So I think getting the information out there, and get it to be more transparent and easily accessible for everyone. And that would be, I think that would be one of the biggest helps to anybody, not just myself, but anybody that need help.
Wonderful. And so that's a perfect segue into, of course, highlighting not only services that are available to other people, but if you don't mind, and thank you for, of course, walking back through such a tough time and a tough year in your life, but can you remember off the top of your head one or two of the services that specifically helped you or that you reached out to that were able to assist?
So at first I called a program SSVF, and from there I got connected with Goodwill. And Goodwill was the one who really helped and changed everything around. As I said, it was all year, January until December. I finally got connected because the thing is, you call a lot of places and they can't help you. They say they can't help, or the program is out of funding, or you're not starting again until next year. So Goodwill was the one who really helped me, and the staff, the service they provide was fantastic. You would believe, you think that it's your own family member. They don't treat you like a number. They don't treat you just like another person they're helping, another veteran. They treat you well, and they're the ones who really helped me. Help me get back on track. Help me find an apartment. Got my car started out, and now my car's running smooth, and everything is going great thanks to them.
That's amazing. So finally, before I let you go, because I know you're headed to work a little bit later, but are you, or what do you think are the biggest gaps in the current transportation system? Because you're coming back, a veteran, you've served your country, you've worked hard, you lost transportation, which of course made it hard to provide for your family. What are the largest gaps in our transportation system that we should address in the future?
Gaps so far, I don't really see any major gaps. As I said, the only issue, because the transportation is there, the help is there. It's just to get it out to people. That's one of the biggest issues that I've seen, not just with myself, but with other people. They don't know that certain things are available. The
Wonderful.
transportation is there for sure. The help is there for sure. The public bus, everything is there. It's just getting the information out to people. That's a major deal, because everything is there and situated properly to help anyone that can dig for it. But not everyone, because some people are a bit older, they're probably not as tech savvy, and they don't know how to just go on Google and search for something. So that's where the issue comes in.
Wonderful. And
Yeah.
so that type of information is invaluable because we not only see that the resources are available, but transportation services are available. But what we need to work on is getting the information accessible and then digestible, understandable, and more transparent so individuals themselves can walk through to find the resources that are there in our city and county.
Yes.
Once
And
again, thank you. Thank you for sharing your story. And it's very important. And I'd love for you, if you have any last words that you'd love to share with our audience.
yes, I would say probably one thing that would help get information out is to probably put flyers at the bus stops, at the bus pickup locations, or posters with probably multiple, programs available so people could see it. That probably would help. That's one thing I can really think of right now that would help people, some people to get the information they need. And yeah, I'm really grateful, because I said I was at a point where the hope was, it was running dry, it was coming on to Christmas, and a holiday gets, started to think about your family, you want to be inside and everything, and they really came through, and I can't be more thankful. Like, I wish I could just give back to everyone a million, So
That's right.
I'm really grateful, and I'm really thankful that I was able to get the help I need, and it went pretty smooth. They didn't care if you're a guy or a girl, the color of your skin or anything like that. So it's just to help people get back on their feet and keep pushing forward. And I really appreciate it.
Wonderful. And we very much appreciate you. So as you've heard, It's beautiful when this city comes together with the resources, when we're not working in silos, when we share information, when we work together. We're not just solving problems and coming up with solutions for our citizens in our communities, but we can actually help them find out resources and ways that they can help that are already available and then create something beautiful from there. Thank you so much. Delan, have a wonderful day at work, and it was great to see you. Thank you for leadership, Winston-Salem.
I thank you, David.
You've
Have a
got it.
great day.
Next, I'd like to move my questions on to Amy Ball-Braswell. So, as a reminder, Amy Ball-Braswell is the Executive Director of Strategic Initiatives at Forsyth Tech. So, Amy, our first question is, how does transportation access currently impact student enrollment, retention, and academic success at Forsyth Tech?
Good afternoon, David, and thank you all for having me. Just to give you a little background, we started doing transportation research around student transportation in 2019, just before pre-pandemic, and did research over the last few years in partnership with funding from the Winston-Salem Foundation and with Winston-Salem State University Center for the Study of Economic Mobility. And we looked at transportation as it relates to those things you just highlighted: persistence, retention, and completion. And what we found during the studies was that distance from campus and access to transportation has a direct correlation with student persistence. And so the further students are away from their local campus location, the more likely they are to drop a class, the more likely they are to fail a class or have a lower GPA in that course. And they're also less likely to enroll in some of the classes they may need if they do not have access to reliable transportation. And all of that then impacts their persistence and retention, and then ultimately their completion.
Wonderful. And of course, this information sounds not only relevant, but true. Has there been any data captured that can speak to the quantifying elements of the effects that you've just responded to?
Absolutely. So as part of that study, we surveyed over 1,000 students. We did focus groups with an additional large population, which I have the number here somewhere, 143 students, with support from Forsyth Futures. And so we have the data to back that up as far as what the students actually said, their survey responses, and how it impacted their lives. This was mostly done in 2019, 2020, and 2021. And we're looking to do some follow-up research in 2024 and beyond.
Wonderful, wonderful. Now, going back to Mr. Delan Mowbray's previous assessment of how difficult his life became due to financial hardship, looking for employment, how does this college incorporate student and community feedback into planning for transportation-related initiatives? And are there any upcoming plans to also address the similar gaps in transportation services at Forsyth Tech?
So we like to center all of our work around student voice. So again, talking to the students, listening to what their needs are. We have a very robust holistic services office on campus called Forsyth Tech Cares that does a great job in supporting students with those life happens things outside of the classroom. And so we gathered ongoing requests through them, but we also have a SESI survey that we do with students to see what other things are impacting their lives. So this is something that we do on a regular basis. And then we also have the students that talk to their instructors or that come into the Student Success Center that give us their personal stories of how transportation impacts them.
Wonderful. And you can't beat anything more than a firsthand account because, as we know, data is data, but hearing it from the hearts and minds of the people, the students that we serve, that's where we get the real feedback, because it's about the end user, those individuals, so we can affect their lives positively and help mitigate some of those obstacles that they face. Finding those firsthand accounts from students, have you been able to utilize any programs that provide students with emergency transportation or assistance, such as rideshare vouchers for schools?
So we do have several.
Oh, and just a brief technical glitch. 1 second. I think we've got you back. And Amy, we're right back with you.
Okay, can you hear me now? I'm sorry.
Sure
We
can.
we call them gremlins up here on the fourth floor. So we do have free 30-day WISTA bus passes for students, so they don't have to keep coming back for passes over and over. Those are provided free to students who need them. We also provide Uber and Lyft cards as needed, gas cards as needed for students who are experiencing transportation difficulties. And we've also had some grant funds in the past to even replace transmissions, buy tires, all of those kind of things that can arise around transportation for students who have their own car or those who can't and then or that don't. And we also promote Share the Ride NC that PART does to make sure students know they can connect with other students on campus to get rides to and from class.
Wonderful. So we already see that Forsyth Tech, and of course you as well at your office, you're extremely busy and involved with our infrastructure in the city. What role can Forsyth Tech play in supporting broader transportation initiatives in Forsyth County? And how can the college leverage its position as a community leader to advocate for further improvements in the future? So I want your wish list. Give us the best.
So, one thing I think it's important to remember is we are the largest institution of higher education in the city of Winston-Salem. And that sometimes folks forget that. We have over 9,000 students, all ages from high school dual enrollment students up to students who are age 65 plus. So we get the full range of folks from Winston-Salem, Forsyth County, as well as Stokes County that we serve. And so I think having a voice and a seat at the table. Sometimes I think we want to include everyone in conversations, but people get forgotten sometimes. So making sure that that we have a representative there, regardless of what their position is within the college, to provide that student voice and provide the voice of our individual students. And also, as we continue to work through this, we know what our students' challenges are, and as they are citizens of this area, we can be their advocates and speak for those who may not be able to speak for themselves in some ways. And so making sure that we're pushing for better access to public transportation, better supports for all age groups, making sure that the school system gets funded so they can provide bus transportation for dual enrollment students, that, WISTA is funded so that they can provide better bus routes to support our students as well as other citizens. So doing what we can to make sure and leverage that influence of being the largest higher ed institution in the city.
Wonderful. That influence and that inspiration is fully felt throughout our community. Of course, everyone at Forsyth Tech Community College doing everything they can.
Yeah.
Fantastic. Thank you so much, Amy Ball. It means the world that you're with us.
Thank you all.
Thank you. And also while we're in between, we have two more panelists to address who have been giving their time graciously to us. I want our attendees to know that your questions can be inputted in the Q&A section. Mr. Delan Mowbray did head off to work, but your questions can be implemented in the Q&A for further discussion, and then we will be back with you with those responses. Next, I will go to Mack Tolbert. Mack Tolbert, mind you, is the director of AirCare Critical Care Transfer to Atrium Health, Wake Forest Baptist. We've heard from our fellow citizens. We've heard from Forsyth Tech Community College, and this is intentional, Mr. Tolbert. We're going to hear from you next. Thank you so much for your time.
Thanks for having me.
Of course. So, your first question, and it's a tough one. How does lack of reliable transportation impact a patient's ability to access healthcare services, particularly in underserved and rural communities?
So that's something we face on a daily basis here at AirCare. If folks don't know, we serve 2 states and about 25 counties, with the biggest majority of that being the rural areas up in the mountains of North Carolina. Especially during this hurricane, we have done so many flights and transports from that location. I mean, it's over 600. The problem that you have is, folks, if they don't have reliable transportation, most of the time they're set in their ways. When they think they're sick, but they won't go to the hospital. So they'll put it off until they've got to the point they have no choice but to go. So they'll call a local EMS service. Is their only option, and a lot of it's due to financial. They don't want to have to pay for that ambulance ride to the hospital. They'll get to the hospital. Now they need to be transferred here to Winston-Salem to one of the larger tertiary centers. And now, how do you get those people here? we've seen ever since COVID a huge spike in our numbers of having to do more interfacility transports, mainly because the local county EMS systems cannot keep up with the demand of their own counties. Plus, over the last 3 years, the price of an ambulance has went from around $140,000 to the last one I priced was near $500,000. So with no increases in Medicare and Medicaid reimbursements, that money's got to come from somewhere. So now it's falling more on the hospital systems to have to transport their patients. So we're going further to get patients by truck or by rotor. And that's really playing a huge impact on these folks' healthcare. And the problem of it is once you get these folks down here, is how do you get them home? Used to be when you was at a small hospital, yeah, we're going to go to Baptist. Well, Atrium's network is huge. It could be in southern Charlotte market. It could be here in the Winston market. So what would normally be a 45-minute drive for some folks now may be an hour and a half. And just how does that happen? If they couldn't get there in the first place, now how do you get them home? So we've had to kind of get creative and use some, local resources, indigent funds, cab vouchers, ride shares, just to get people back to their home community.
Wow. And so you mentioned that the challenges you face operationally are difficult, but can you speak to the operational efficiency? What does it look like with these challenges, the deficits in funding, needing to get your patients back home once they're under your care? How do you approach operational efficiency when you have those type of obstacles when you're in your position?
So for us, we're on the front side of things of how to get the folks down here. So, we have to look at our overall call volume, and, you can only make so many trips, to the west, to the mountains in a night. So if you got 20 calls, which is what we average in a 12-hour shift, 20 to 30, depending on, do they come by helicopter? Do they come by truck? So some people actually may be waiting longer in these smaller facilities just for a ride down here to Winston. So a lot of logistics has to play into that and what's going on. The other part, like you said, is once they get here, how do we get them back? So the amount of man hours spent just researching options. Is there a family member? Is there someone willing to come pick you up? Does your community have some form of a rideshare program that they would come and pick you up with? Do you even qualify for a cab voucher here? And then the other part is, how far will the cab go? Are they willing to drive 2 hours to one of these rural communities? So that's some of the really big challenges that we address. Luckily, we have a care coordination department that kind of tackles that and tries to get a jump start on it. And then the other part of it is that we run into is if you need long-term care, where can you be placed that's going to be close to your home?
Right. And so you talked about the difference between the distance that people travel and where you have to deliver them, going from 45 minutes to potentially an hour and a half. What is Atrium doing to provide equitable care and transportation with the differences in social class, as well as the difference in how far someone is or close they are to services in a rural versus city environment?
So there's a few things that Atrium's done in the past. One of the biggest things that we did here in our Winston-Salem market is, of course, Atrium is a nonprofit health system. So whether you can pay or not, we're going to treat you. We don't, discriminate any against that. But in 2018, we changed our model for our helicopter service. Everybody hears about these monstrous $60,000, $70,000 helicopter bills. And, that really scared people from going in a rotor. So we went back to a nonprofit hospital ran flight program, which dropped our bills drastically 50 to 55%. So, and with that being a nonprofit, we still follow the same charity funds that the hospital system used. And we've seen great success and the lack of fear of flying. The other part of it is we've looked at the numbers of where our patients are coming from. Is this a place where we need to put a base at? So, we noticed a need in the Wilkes community. So we have a ALS ambulance station in Wilkesboro. We also have one in Mount Airy, North Carolina. So we can offer quicker service to them in that route. And then on the other side of things in Atrium, Atrium goes all the way down to Georgia now. So they're looking at the communities that have lack of healthcare and can we build a freestanding ER? We may not be able to build a whole hospital, but can we put an emergency room in your area with an ambulance for the hospital, treat you and get you back here to the medical centers of that region?
Wow. So it seems as if it's not just the obstacles that are presenting with challenges for Atrium, but that Atrium's looking at ways to just better serve everyone. So how is Atrium looking to help reduce transportation barriers for vulnerable populations? Now, this comes as elderly individuals, people with different abilities or disabilities, patients with chronic conditions who require frequent visits. How is Atrium addressing the vulnerable patients?
So we have a really neat thing that we're doing here, and it's called mobile integrated health. A lot of counties do community paramedicine. So this basically means that when you would normally be in the hospital for 5 to 6 days, like day 3, you would get discharged home. And then we would send a paramedic to your house on days 3, 4, and 5. They would also use our technology that we provide. You would do a video conference with a physician. Our paramedics will do your blood work, provide your medications, do your repeat labs, and you can do this all from the comfort of your house without having to go back to the hospital. And we're seeing on average around 35 patients per day in our community with hopes to double that within the next year.
Wow. That is impactful. Have you noticed a correlation in lower call volume with your ability to care for more patients with this new program?
Actually, it's a higher call volume.
Wonderful.
Because if you take those 35 patients that we're seeing at the house, that's 35 patients that would have been in the medical center. So now we're able to treat an additional 35 patients here in Winston in the hospital. So we're able to actually provide more services to the region.
So I know a lot of the fear for citizens is I don't know whether to use virtual. I don't know whether to use remote care. I don't know whether to go into an ER room. Am I going to be waiting longer than I will for the amount of time I'll be seen for the care? But with your services, how do you see Atrium multiplying the effect of being able to provide care for city and rural citizens?
So there's some stuff that's coming in the future called a virtual hospital. Instead of being admitted to our hospital, you would be admitted to your house. And we would bring everything from pharmacy, meals, the physicians, nurses, paramedics, physical therapy, straight to your bedside at your home. So all you would be responsible for is that initial transport to the hospital to seek care, which you would do via local EMS or by car. And then we actually will take you back home in an ambulance because you're officially admitted to a hospital hospital bed that's in space. It's probably some of the neatest things I've seen lately. Charlotte's already doing it. It's coming to the Winston market next year. So you have to work with, that's just one small part of it. The other part is working with your local community partners with home health, local EMSs that do a community paramedicine. You look for the folks that are the vulnerable folks that may just need a paramedic sent out to their house and said, it's okay, you're going to be okay. Let's work on getting you a doctor's visit or a doctor's appointment. Maybe we can try to do it virtual versus having to go to an emergency room and sit for hours just to be seen, where that could be handled in a clinic.
Wow. That is game changing. We're not only looking at having a easier access for citizens to get the care they desire, but a lower response time from when they seek services to get seen to being transported back home. It is revolutionary.
Yes.
All right. Thank you, Mr. Tolbert. It means the world that you're with us today. And of course, we can't do anything, whether it's from Forsyth Tech, whether it's from Goodwill Services, whether it's from the veterans, or whether it's from AirCare Critical Transport, without the transportation in the city of Winston-Salem. So of course, I'm going to kick my next couple of questions off for Mr. Jeff Fansler. Reminder, Jeff Fansler is Director of Transportation with the city of Winston-Salem. Of course, he's dedicated his career and he is a flagship class of 2025 inductee and future graduate. Welcome. How are you, Jeff?
Thank you, David, and I appreciate the kind words. I'm happy and honored to be a part of the Flagship 25 and inspired by the panelists so far. So I appreciate Leadership Winston-Salem for hosting this afternoon.
Yes, sir. And great to have you with us. So, Jeff, how does the city's long-term transportation strategy address the growing population and increased demand for public transit? Secondly, what changes or improvements are planned in the next 5 to 10 years?
So thank you for the question, David. And I'll frame that you mentioned the term strategy because I think there's a key phrase, very simple phrase that summarizes the direction that I think public transportation is moving in our city, and that's the phrase "be bold." And I'll pause there because some of the comments I'll make, I won't take credit for, but I'll highlight the great work. Part of being a great leader, I think, is hiring the right folks to do the great work. And so I know my assistant director, Kelly's on the call tuning in, and I'll highlight her great work, and we'll recognize her for some of the things that I'll comment on. But I think our strategy of being bold is what we mean by our strategy. And that's done really in the concept of respecting folks' time. So you mentioned the 5 to 10 year strategy. I think what we're going to do over the next 5 or 10 years is look at time. One of the barriers to transportation and really for public transit in our city is 2 factors of time. Number one, the time it takes to ride the bus, that they're sitting on the seat of the bus, and 2, the time at the bus stop, waiting for that bus to arrive, right? And so I think over the 5 to 10 years, we're going to take a really close look. And really, in the last few years, we've been really diving deeper into this and to addressing those 2 elements of time, where we can hopefully introduce some improvements that will address the demand that we're seeing to give folks their time back with not having to ride the bus so long and having to wait at the stop so long to receive the bus.
That's right. And of course, we're not just dealing with individuals and regular citizens going to and from work. We're dealing with elderly, we're dealing with children, we're dealing with students. So what existing transportation services or partnerships does Forsyth Tech offer? What steps are currently being used to expand public access to transportation, particularly for individuals that rely on transportation for employment?
So great question. And so we have had targeted looks at this access to jobs, access to really economic mobility. And one of the things that you may notice, especially if you're been in the area some time, is that during the height of COVID, we had to draw back on some of our evening service, which really, when we went out and we asked the question, for jobs, what do you need? And overwhelming majority told us we really need the return trip. What we see in our city right now is that oftentimes we can provide access to a job. It's the return trip and the time of that return trip where's the barrier, where that complicates that day of that employee for whatever business that they're trying to get to. And that element of complication removes their interest in public transportation. And so we have to address that barrier, invite them back to ride our night service. So I'm happy to say, David, that on November the 11th, we'll be bringing night service back to address that very same thing. So hopefully we'll see some improvements in the near future where we've heard you, we've been able to staff accordingly, get the proper funding, the right contractor in place to return that night service. But I want to mention one other thing too, because one of the things that we've studied pretty clearly in detail is this. We have an older kind of hub and spoke model with public transit, and evidence is real clear, right? That is driving some of the time delays that we're experiencing. So some of the things that we're going to be considering as we look for modernizing and improving our transit service will be, how do we provide access to jobs that don't require you to go downtown to transfer to get to your job, right? How can we introduce route changes that are more efficient, that maybe take out some of those inefficiencies with where we're going, but also do we need to add some crosstown routes that don't require that trip downtown to the bus terminal to transfer, to ultimately get on the proper route that you're trying to get to your job. So you'll see some things hopefully in the near future that addresses those transfer points that address specifically access to jobs.
Wonderful. And I think that's important that you're looking at the perspective of the end user, of the citizen, of the driver, of the riders of our bus. And of course, we talked about efficiency, but I'd like to pivot a little bit to affordability.
Sure.
So what is being done to address the affordability of public transportation, specifically for individuals that are unemployed or underemployed? And are there reduced fare programs that are available for financial hardship?
So great question, David. And we get this a lot. Currently, for those that don't know, to ride public transportation in Winston-Salem, it does cost $1 a ride. And there are certain programs that I'll highlight now, largely related to our Bus Pass Match program, where we partner with local nonprofits in our community, David, where that allows us and the city to contribute a matching pass for that nonprofit. And so those nonprofits can coordinate and apply to our department and say, hey, I want 5,000 rides, and the city will match that 5,000 ride contributions. And the city, allocates budget every year to accommodate that bus pass matching program. And so we're happy to promote that. We're happy to partner that with a number of agencies in the community. And frankly, you've heard already, David, that we probably need to tell that story more frequently. We need to let folks know about that. And so a takeaway for me personally today will be to educate and figure out better ways to communicate those type of matching programs that the city already offers. But then I'll also say this, while our fare has been $1 for a long time, right? And the cost of providing transit is far greater today than it was, say, 5 years ago, right? Far greater.
Yes.
But it begs the conversation, and where we're heading now is at least having the conversation with city leaders is, it's costing a lot of money to collect a little bit of money. And so is there opportunity maybe in the future where we have a consideration for fare free? And those conversations are happening now. At a $25 to $30 million annual budget to operate our public transit system in Winston-Salem, the conversation now, if we're offering around 2 million rides a year at $1 a ride, we're spending a lot of money to collect a little bit of money. And so there's conversation about, is that the way our model needs to be in perpetuity as we figure out the best way to offer service to our citizens?
Wonderful. And so, well, the best part about where we are right now in our panel is that we've got the perfect amount of 10 minutes where I can bring each of you, the panelists, back and see if you want to highlight either a program, a wish, a desire, or an observation, because right now you've got the leaders and captains of industry. You may not all be able to see us. We may not all have our cameras on, but trust me, the colleagues and individuals that work with Leadership Winston-Salem are here transforming our communities. And we're here with open hearts, open minds, and hopefully a pocketbook or two for a grant that can help fund some other initiatives for you in the future. What can we do to serve you? Anyone can start. Feel free.
So I think the one thing that I would say is if there was a grant or any kind of major donation available would be ability to have some form of a wheelchair van or a mode of transportation that could serve all populations that could get these folks back home at 3 o'clock in the morning. That's the hardest time. During the daytime, it's great. Everybody's in their offices. You've got access to resources, but these ERs, in the middle of the night, they're kind of on their own, trying to figure out how to get these people home. And you just cannot sit an elderly person in the lobby and expect them to do okay. They're going to be back. And you just can't tell them to walk out when it's 20 degrees outside. We as a health system and a community have got to figure out ways that we could address this somehow.
Wonderful. Thank you. Heartfelt and implement with care. Of course, we have the largest population being the elderly, who are now finding themselves either without family members themselves to care for, or they're not being technologically savvy enough to work around a system that is now moving online. So we need as much support as we can there for Mark or Mack. All right. Amy Ball Braswell or Jeff, any final words, any thoughts you have for us, for our leaders here on the call?
Jeff and I have talked about a couple of different options in the past for providing like specific transportation things, but the idea for me that he just mentioned about fare free, there are a lot of communities that, especially toward the Triangle area, that allow students to ride public transit for free, and that's funded through the Department of Transportation. It's usually a state transportation grant. So making sure that as we're looking at this, we're making sure we're being inclusive of all populations. And for us, for our students, I think we can move more students to the public transit system if they knew it was free and open and a little bit more convenient, because that's the other thing we kind of run into with timing. like he referenced the hub and spoke. We don't have a single bus right now in the city that goes to more than one of our campus sites. And so for most of our students, a 15-minute drive ends up being an hour bus ride or more, because they have to go downtown or somewhere else to switch buses. And so that idea of making it a little bit more responsive was great to hear. And of course, all of this requires money. So making sure that either the Department of Transportation or other private funders are able to step in and make some of this happen.
And
Wonderful.
thank you, Amy. And David, I'll just make a final comment too, because I think Amy's right. You know, funding is going to be a key player in this, but additionally, one of the things that we're looking at is how to leverage the current fleet that we have, the current operators that we have, right? And so we've taken a really hard look at where routes are underperforming. In other words, there's not very many seats filled on those buses. And I mentioned that term "be bold" early because we're going to have to make some hard decisions, right, to maybe recycle some of those buses and operators to where the demand really is, to
Right.
where we can solve the problems that Amy's talking about, like Mack's talking about. And I think we have to make some bold decisions where the best good we can do with the resources that we have is to recycle some of those in underperforming routes and provide that frequency, turnover, headway, intensity that I think that our community really wants.
Wonderful. Very well said and thoughtful. Once again, I want to thank Mack, Jeff, Amy Ball. We've got some closing remarks here from Frida, and of course, you as the leaders. We had some questions come in from the Q&A section. So with these next couple of minutes, I didn't know if Frida, you wanted to kick one or two of those to our panelists. Feel free.
Thank you, David. Absolutely. We did have some questions from our participants, and I'm going to read some of those here. This is actually more addressing to Jeff. One of the questions was, are we looking to add more shelters, benches, and platforms for riders? Many in our community only have signage that are on hills and are directly at street side, making these conditions not safe or conducive for seniors, children, and those with special needs. So what are the city's plans there?
Great question. I'll answer this in 2 minutes because I'm happy to say the City Council has just adopted a new service amenity standards policy. It's really the guiding publication on how we will administer service amenities. And really, I think we can make an argument that they should be there. Maybe amenities is not the right word to even use, right? They should be there for the folks that need it in the community. But I'll say this. We have to, given that we are fiscally constrained, we have to make the most sense of where we apply the resources. And so those guidelines I just mentioned will be largely around where our ridership demands are. But I will say we have shelters, we have documented need for where they should go. And I think that amenity standard policy that City Council just adopted will give us the direction we need to deploy those in the community. And you'll see more of that in the next 24 months.
Thank you. Thank you, Jeff. Another one of the questions that came in through the Q&A was, what are the additions and improvements to bike paths to help cyclists get to and from work? You know, obviously bicycles being an alternative mode of transportation, but one that could be very viable for some members of our community.
Yeah, great. And so I'm happy to say, one, this is a great question and timely because we are embarking on our 2050 Metropolitan Transportation Plan, which will document really the transportation needs for our community. So I would encourage us all, and this is where we can ask for some assistance, to engage and tell us where we need those improvements. And so there's publications on our website and surveys, public comment centers, all the above that we would ask you to engage with us on where we are falling short. But one of the things that I'm happy to say too is that we partner on all new projects, and we utilize what's called a complete street policy, where we are going to be looking at all modes of transportation that we can introduce for all new infrastructure. Now that is new infrastructure because certainly there's barriers for existing infrastructure where we had to retrofit the older conditions where we didn't plan very well. And so we have a long-term bike plan and greenway plan that addresses some of those. And as I've mentioned before, it all is tied to our ability to fund those projects. And so any legislative authority we have on the call will be great to help us get those dollars as we look to deploy those resources. So great question.
Sorry, I was on mute. Thank you so much. There is another, some comments that were kind of, another question in regards to bicycles, but I do think you addressed that, Jeff, was that are there plans to expand bike lanes as an option for transportation in the city in terms of ways that the citizens can come about and help is to those engagement pages that you were referencing. I'm going to ask Jared if he can find those on the website and post them in the chat for all of our participants today. So if we can, before we end the webinar, we'll try to look for those. Kelly made the comment, helping to advocate at the legislative level. And I would implore that starts at the local level, right? It starts right here locally, and also as we go further on up the government ladder there. A question from Mack. What is Atrium doing to support their staff who are facing transportation issues?
So I can only speak from my department, and I can tell you some of the things that we do. So with us having 8 bases across 2 states, I look at where we hire our employees from, and I try to schedule them as much as possible at the base closest to their house. So if you lived in Martinsville, I'm not going to ask you to drive to Wilkesboro to work a base. I'm going to work you at our Martinsville helicopter base and maybe our Mount Airy truck base. And then in the event we have call outs, so I do have to move staff around, Atrium Health will reimburse your mileage for driving above what your normal daily commute would have been. So you can get reimbursed for some extra fuel that that you incur, and just try to be creative in different ways, scheduling shifts together with folks that you might be able to ride with to cut on gas prices and so forth, because it is expensive. And doing as much as we can now with virtual. I will say that's one of the best things I think come out of COVID was Zoom meetings and team meetings. I think we're much more productive. You do lose that personal touch, but we do get a lot more done. Thank
you. Any other final comments from any of our panelists, of things that you would like to share, initiatives that your prospective industries are working on, or any resources that you think are vital for our participants to know about today that you haven't already shared? The one last thing I would say, if there is any legislative part of this group, is that, we always talk about healthcare crises and stuff, but the ambulance market is a healthcare crisis. What we used to could get a brand new ambulance built in 90 to 120 days is taking anywhere from 24 to 36 months to get a new ambulance at near double the cost. So you're going to see ambulances on the road with 400,000 miles that should have been replaced years ago, but now you're having to wait with more use, more volume. And I really don't understand how some of the communities, Jeff talks about financial constraints. I don't see how people are going to be able to afford $500,000 ambulances in the near future just to be sustainable. So there's got to be something done to replace some of the aging fleet that's out there. And this is nationwide. Thank you. Thank you for bringing that to our attention. I will kind of point everyone's direction to I think it's the webinar chat. There's some links that have been provided there, information on Winston-Salem's bike lanes, as well as those engagement pages that Jeff mentioned for community feedback, to receive your comments and thoughts about ways that we can improve the city of Winston-Salem's transportation. If there aren't any other further comments, I want to say a heartfelt thank you to our panelists today for joining the conversation and for the incredible work they're doing to make transportation more equitable in Forsyth County. We are excited to announce here at Leadership Winston-Salem that we have a new website that is live now, and it is filled with valuable information, resources for alumni, and those who are looking to get involved. It's your gateway to stay connected, make an impact, and keep up with our events. If you are an alum, please make sure to check out the info hub to stay in the loop. If you are not yet an alum, please look at the website to see ways that you can be involved. There are volunteer opportunities and ways to connect with our alumni and our leadership. Speaking of events, don't miss our upcoming community conversation, where we're going to tackle the childcare crisis. We're bringing together local leaders from UR Childcare, Smart Start, and Thrive More to discuss data-driven solutions that will impact families, the workforce, and our local economy. Jared is going to drop that event link and website in the chat now, so please be sure to check it out. Finally, Leadership Winston-Salem is a nonprofit organization which relies on the generosity of supporters like you. If today's session resonated with you, please consider making a donation to our mission. You can click the Donate Now button on our website or use the link that Jared is now sharing. Thank you again to all of our participants and our panelists. Thank you, Delan, for joining us. I don't know if he's still on the call, but we appreciate you giving your personal testimony. Thank you and have a fantastic rest of your day. Bye-bye.